Holly, if you'd like to introduce yourself, you may then proceed.
Certainly. Good morning. I'm Holly Leahy, Administrator for Lebanon County Mental Health, Intellectual Disabilities, Early Intervention Programs. This morning I'm here to present several different items, and I will begin with the Crisis Consultation Grant. A little explanation about that grant. In October of 2022, we received a funding announcement from the Office of Mental Health and Substance Abuse Services, giving us the opportunity to submit an application by November 9 of 2022 to apply for Federal American Rescue Plan Act of 2021 funding. This funding opportunity was specifically for county crisis system planning. Upon approval from our county commissioners, we created and submitted a grant proposal requesting $175,000, which was the maximum, for county crisis system planning, again on November 9. This grant was to hire a consultant to complete a comprehensive assessment of our current crisis intervention services, to produce a strategic plan to comply with the Office of Mental Health and Substance Abuse Services mandates to transition to a full walk-in center and mobile crisis team delivery model by 2028. This includes programmatic assessments as well as fiscal as to what we will need in order to comply with those mandates. Our application was approved by the Department of Human Services on December 21 of 2022. In order to procure a qualified consultant entity, we created a request for proposals, we call that an RFP, and that document was distributed to potential consultant agencies on April 3rd of 2023. We received one proposal from the Panto Group on June 2nd of 2023. And we did have a selection committee of stakeholders that reviewed the proposal on actually two different dates, June 19 and July 5, to make sure that we were very thorough in our review and whether or not we would recommend approval. Our selection committee is requesting your approval to enter into a contract with the Panto Group for a maximum of $232,106 for a 21-month time period. This will span two different fiscal years, fiscal year 23-24 that we're currently in, and then fiscal year 24-25. The total amount is the $175,000 in the American Rescue Plan Act funds, and then they're requesting an additional maximum of up to $57,106, which would be paid in mental health base funds, again spread out over those two fiscal years. We believe that that will be able to be covered under the base funding and the block grants, so we are not requesting any additional county tax dollars for the Crisis Consultation Grant.
Okay. Motion?
Motion to approve.
And I'll second the motion.
Any questions regarding this project? Yes.
I guess just for my own knowledge, Phil Haven is our current provider. It would have been a conflict of interest for them to bid on this. Is that correct?
It absolutely would have been, yes, and actually there were several other entities that were wanting to submit a proposal, but again, it would have been in conflict of interest. And again, we were seeking qualified and experienced consultants to complete the assessment for us. WellSpan Phil Haven doesn't currently do those assessments per se. So
well, we do pay them to do treatment.
Well, of course, yes. This is an assessment of the program and really delving into what the state is mandating and what we need to transition into. So what that plan, that strategic plan will look like is gonna be really fun to go through the process and see what that plan looks like.
Mental health is on so many people's minds and they are local, so I was just trying to anticipate a question that might come up, so you've answered it very eloquently. Thank you.
Thank you.
Okay. All in favor of this Crisis Consultation Grant proposal? Any questions? If not, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign. So moved.
Thank The next item are contract amendments for fiscal year 2022-2023. This is a fiscal year that we just ended on June 30th of 2023. There are 17 contracts amendments in total, 5 for our intellectual disability program, 4 for mental health, and 8 for early intervention. This is mostly for additional units needed to serve consumers, with a combined contract changes of $263,398. I do want to give one explanation, one contract, which is the largest, the Keystone Service Systems, in the amount of $200,000 for building and land assessment. So during our contract negotiations for the fiscal year 23-24 and a thorough audit review of Keystone's financials, it was revealed that our initial startup costs for the home were not sufficient, and indeed Keystone had taken out a loan in the amount of $200,000 to cover the building and land expenditures. So instead of paying, they were looking for us to pay over $1,000 per month in interest alone for that loan beginning fiscal year 23-24. Out of fiscal year 22-23 block grant funds, we really crunched those numbers, and we believe through the combined department block grant funds, there are just enough funds to cover that $200,000 and to really make good on the monies that we owe Keystone Service Systems. So we would not be requesting any additional county tax dollars in order to pay that debt to Keystone Service Systems.
I'll make a motion to approve the 22-23 contract amendments as presented.
Second.
It's been moved and seconded. Any questions? Hearing none, all in favor, please indicate by saying aye. Aye.
Aye.
Opposed, same sign. So moved.
Thank you. And then finally, one more contract amendments for our current fiscal year 2023-2024. There are just 2 in the amount of $12,000, $324. I'm sorry. I do want to note that the second is Dr. Beth Townsend, our contracted psychiatrist. She has submitted her resignation and will not contract with us. Her initial effective date for that was July 13 of 2023, but she has extended that date to August 31 and offering 1 day per week to give additional time for patients to be transferred to the community outpatient clinics. And I will say that the highest need and the highest need population are really the Medicare folks, that we're having difficulties finding providers that have enrolled and credentialed with Medicare. So that is most definitely the highest need in our county. So again, we are not seeking any additional county tax dollars. These would be covered under our current allocation for fiscal year 23-24.
Make a motion to approve those amendments as presented.
Second.
It's been moved and seconded that we approve those amendments. Any questions? If not, all in favor, please indicate by saying aye.
Aye.
Aye. Opposed, same sign. So moved. Thank you, Holly.
Thank you very much.
Thank you.